Good morning. This is Elliot Sloane from Florida in the U.S., joined by Riad Farah as the co-moderator for this morning and afternoon session. From Lebanon, he is joining us. We have three speakers, Paula, Berrio, Kim Greenwood, and Murilo Contó, who will be talking about their efforts and successes in cost and ROI management. Next slide, please. Next slide. So we have been doing presentations and discussing at advanced clinical engineering workshops the concept of cost and support for clinical technologies for decades. Some of my involvement goes back to early days of 2001. Next slide. We also have presented these in tiny countries like Dominica. We've had speakers and lecturers from throughout the world. Next slide. We have expanded the discussion to total cost of ownership to consider the complexities of computers and networks, which adds greatly to maintenance, security, and other costs. Next slide. We've created spreadsheets and simple analytic tools to look at the cost of inflation, deflation, cost of money, net present value of investments across many different kinds of technologies. Next slide. All of these are in the context of the total cost of ownership for clinical technologies is maybe only 1/10 of the overall cost of support and maintenance over the life cycle for all kinds of clinical technologies today, and that cost is going up. Next slide. We know our real costs are way beyond the purchasing costs. It's the classic tip of the iceberg. Next slide. I've been writing some articles and chapters to try to address this inflating cost and the management of it. Next slide. All of this really harkens back to ECRI's first publication of Devices and Dollars in 1985, when something as simple as a spreadsheet required timeshare, or what we now call cloud computing, in order to do these calculations. Next slide. And now we have to deal with the COVID-19 coronavirus technology decisions and those long-term cost management issues. Next slide. And that includes ancient devices that we're pulling out of warehouses and stockpiles, diverse ventilators coming from many other hospitals and donors, new open source ventilators and products that are being built in individual hospitals, and new products that have EUA or emergency use authorization only, that in fact may not be used past the duration of the coronavirus pandemic. Next slide. There are many topics in the cost of effectiveness discussion. The next few slides are simply from the overall outline. We're looking at health technology broadly, what it is, the role of the clinical engineer, what he and she does in this world, and the concept of cost effectiveness and return on investment. Next slide. There are many resources that are available to all of you. All of the slides and materials that I'm presenting and everyone else here is presenting will be provided to you, and we're more than happy to provide additional information by the email addresses that you already have. Next slide. There are many, many principles of the clinical engineering community. All of these are broadly written about. They are not that easy to understand or conquer, and we're all in the midst of learning, and that's what this session is about. Next slide. There are so many cost impact and implications for every decision we make. It affects our current budget, it affects the overhead of the hospital, it affects the staff, the long-term maintenance, and the viability of healthcare in each of our countries. Next slide. Now we'll change to Riad and let him talk about some of the MENA concepts and issues. Welcome, Riad.
Thank you. Thank you, Elliot. Hello, everybody. I'm so pleased and honored to be co-moderator with Elliot, and very happy to present the experts in clinical engineering fields and hear their success stories and leadership in hospital, regional, and national level. They will be presenting their expertise on how clinical engineering can lead a cost-effective HTM. I personally worked in the Middle East area, in the AMRO region, also called the AMRO region, with the Arab Hospital Federation and the Middle East North Health Policy Forum, MENA HPF, and of course collaborated with the IFMBE. We have around 28 countries in the Middle East North Africa region. Definitely different countries, they have different healthcare systems, they have different plans and different economies, and therefore they have different technology levels. Some countries, they have big investment in medical devices, while some others lag a little bit behind. And this is normal, but what's essential is that all clinical engineers have common challenges in all countries, whichever is the level of investment, because we need to manage these millions of dollars of technology and we need to manage them properly. That's why we all need proper HTM, health technology management. We all need proper health technology assessment, and we need proper regulations and accreditation. Obviously, the MENA healthcare market is worth around $144 billion. It's a big healthcare sector. And in the Gulf region, which is called the GCC, they have $69 billion healthcare worth. And this is big. And that's why we need clinical engineers, very effective, very active in this area. It is good to mention that two countries, Saudi Arabia and UAE, have more than 74% of the healthcare market in the GCC. And that's why there is a big variation between one country to the other. It is worthwhile mentioning that the medical device market growth is expected to grow by 8% in the MENA region, which is much higher than any other market. And this is as per the Euromonitor. And Lebanon had the higher density per 1 million population as per WHO in 2013. Another point to mention is that the hospital beds density in the MENA region is a bit less than other countries in Europe and America. So we expect lots of hospitals to be built, and there is a big need for extra hospitals. So a final note, a take-home message, we need to work together. We need to attend IFMBE webinars and to learn and improve in clinical engineering and leadership skills, and improve awareness in clinical engineering and promote recognition. These words are very few words just to mention the importance of clinical engineering work. Next, please. Now we're gonna hear 3 important stories from colleagues, from experts, from Colombia to Canada to Brazil, and they're gonna share with us their expertise and cost effectiveness and their management of their medical devices and the savings they did. Paula Berrio from Colombia, she's gonna tell us her success story in the hospital, on hospital level. Kim Greenwood, working from Children's Hospital, Ontario, Canada, is going to propose and explain the cost effectiveness approach through a regional clinical engineering service in Canada. And Murilo Contó from Brazil is going to explain his expertise with the Ministry of Health on nationwide expertise, proving the cost effectiveness and total cost of ownership of medical devices. Please, the floor is yours, Paula.
And before we begin, just to let everybody know that we will be taking your questions in the chat box. We've asked each of the speakers to speak for 15 minutes, and then we will come back and answer all the questions that we can. Paula, the floor is yours.